His first public address of the year, Premier Doug Ford re-announced that Ontarians can go to local pharmacies to receive treatments for certain ailments. Now, that's an attempt to ease strain on Ontario hospitals, but the Premier wants to go further by having more procedures done in private clinics. Premier Ford says more could be done to ease the strain on hospitals, particularly in operating rooms.
And I've talked to many surgeons, and he said, Doug, my problem is I don't have operating room time. And he said his boss told him, well, just go out golfing instead of, finding another avenue, another operating room.
However, the chair of the Ontario Health Coalition, Sutherland, says operating rooms are anything but filled, and the province is to blame.
For a long time now, the provincial government has been cutting funding to hospitals. And when that happens, hospitals restrict operating time because they can't afford to pay for the surgeons to come in. And so we have operating rooms sitting empty in hospitals. We have surgeons like this gentleman who we talked to who's got spare time.
Regardless, Ford is calling for private hospitals and clinics to ease hospital wait times by performing simple operations like knee and hip replacements at no cost to Ontarians.
No Ontario will ever have to pay with a credit card. They will pay with their OHIP card.
Sutherland says while patients aren't paying up front, incorporating more private clinics only increases the cost to the province and thus taxpayers.
When you're running two parallel systems, private system and a public system, the administrative costs of doing that and the costs on the system in terms of staffing and shortages and people going to emergency department and can't get in are significant.
Green Party leader Mike Schreiner is calling on the Premier and Health Minister to, quote, stop trying to sell privatization. He says, quote, drop the appeal against Bill 124 decision and immediately implement a nurse retention strategy that includes permanent raises and better working conditions for all healthcare workers. Sutherland adds that according to his own research, private clinics tend to try and upsell patients with tests they normally wouldn't need.